Gove County Medical Center's Physical Therapy Department is introducing a new service to their patients, Complete Decongestive Therapy, or CDT, to treat lymphedema. What is CDT? Jessica Polzin, Certified Lymphedema Therapist, joins me today to explain this new therapy. So what is lymphedema?
So lymphedema is a condition where there is a fluid retention in a limb or multiple limbs. It occurs when there is a malfunction of the lymphatic system. So this built-up fluid can cause swelling. So if you suffer from swelling, it may or may not be lymphedema. There are several different forms of it out there. In the United States, the most common culprit is cancer treatment, but there are other culprits as well. It could be a hereditary issue, it could be the result of trauma, it could be the result of a combination of conditions such as a cardiovascular malfunction, and the lymphatic system can be overwhelmed, and thus you get that swelling.
What does the lymphatic system do?
So the lymphatic system is kind of like the circulatory system. It travels through the entire body. And what it does is it removes waste from the tissues, proteins, used up nutrients, and the nodes themselves help create lymphocytes, which common name is white blood cells. So the lymph fluid goes through the entire lymphatic system, and then it's dumped back into the circulatory system. So those nodes create those lymphocytes, they travel through the lymphatic system, and they're dumped back into the circulatory system, where they act as your immune system.
Why should people seek treatment?
Seeking treatment is important because you have to learn how to manage the disease, because currently there's no known cure for lymphedema. What happens in lymphedema is you have this protein buildup in the tissues, and that protein brings more fluid to that area, which means more swelling. This can impact the integrity of the skin and increase your risk for infections. Probably the most common infection for individuals with lymphedema is cellulitis. So while lymphedema itself won't kill you, the infections can. These individuals will also notice trouble with clothes fitting appropriately. They might struggle with things like walking. If it's a leg, it can affect your balance. It can affect how you feel in general. These individuals will often complain that their skin feels tight, it's uncomfortable, they just can't get comfortable depending on how large this limb actually is. So treatment becomes very important to help reduce your cost overall of living and improve your quality of life and comfort.
What can patients expect from this new treatment?
So treatment can consist of multiple different modalities. It can include manual lymph drainage, which is kind of similar to a massage. And what that does is it helps move that fluid around to better lymph nodes for processing. Then there's compression therapy, which can consist of bandaging and or garments, which can help maintain those gains made from manual lymph drainage, as well as reduce the size of that limb further so that it looks more normal, feels more normal, and is easier to perform tasks. There's also exercise, which becomes important because normally the lymphatic system is pumped by muscle action. So it's going to help increase the efficacy of that lymphatic pump. Then there's self-care, which can include skin care as well as wound care as if there's wounds present, as well as learning how to perform things like dressing and bathing again, because some of these individuals have been so large for so long, they don't remember how to tie their shoes, or they're just not used to doing it anymore. So it becomes important to relearn how to perform those tasks.
Thank you for joining me. And thank you for watching. For more information, visit gcmc.org, like us on Facebook, follow us on Twitter and Instagram.